Since January, we were watching COVID-19 very closely, trying to find out what our health departments and what our hospitals were doing to prepare.
The deadly coronavirus officially hitting the U.S. A Washington state resident fell ill after returning from Wuhan, China, where the outbreak began.
By February, we took a survey of the hospitals, and we were shocked and scared. They were not prepared.
If we are complacent and don't do really aggressive containment and mitigation, the number could go way up and be involved in many, many millions.
New York reported its first case of COVID-19 on March 1st. Within a week, we started seeing a lot more cases. By mid-March, we were completely inundated and our hospitals were overrun with very sick COVID patients.
What we're seeing is a tremendous shift. We see a tidal wave coming at us, and we're scrambling to try to prepare for it as much as possible.
Because nobody was prepared, not our hospitals, not the state, not the federal government. And the Centers for Disease Control and the Department of Health were giving dangerous guidance, contradicting the science.
Before all of this happened, Courtney, basic infection control was that the moment that mask had been utilized once, you removed it at the end of the experience with the patient, and you threw it out. You washed your hands, you came out the room, and then when you had your next patient encounter, you would put a new mask on. With everything that is developing right now, it's like we're developing new standards in infection control, and they don't seem like they're guided by science. They seem like we are doing it because there's a shortage of equipment.
Nurses are always the first line of defense. We go there to defend our patients, but there were no one out there defending us. We went in without proper PPE. We were asked to wear the same mask, sometimes for 5 to 7 days. Last year, if you went to an isolation room wearing the same N95 more than once, as a nurse, you would have been reprimanded and written up for that.
Sweat is pouring down your face, and they're telling you to take the same wet, snotty-nosed mask and wear it for 5 days. That is unheard of.
We are reusing our N95s for days and sometimes weeks at a time.
We realized it was all on our shoulders. Protecting ourselves, protecting our coworkers, protecting our patients, protecting our families, and protecting other frontline workers.
We came into this career because we want to help people, but we were not asked to set ourselves on fire to keep others warm.
You don't send a soldier into battle without a weapon, and that's what we feel like is happening to us.
I heard that you had said to one of my producers that you feel sometimes like what's happening in your hospital is like fighting a burning house with a water pistol.
Yeah, absolutely. Because, you know, as a New York City paramedic, I know exactly the kind of protective gear I need to have on if I was in a biological warfare. And I know that this is not a biological warfare, but what we're walking into, for example, the outfit that Emily has on does not protect you against COVID-19.
Among nurses that you talk to, is it gotten to the point that they really are aware that every day they could contract this and that their life is on the line?
Absolutely. Because we don't have we're short on personal protective equipment, coupled by the fact that we are not getting tested. If we are told, even with a known exposure, that we are to continue to come to work, this is not normal. Yeah, there is a high level of fear and anxiety among us.
You know, not having the proper protective equipment really made people angry, and justifiably so. There's no reason for anyone, especially a registered nurse, not to expect that the equipment that they need to deal with an infectious disease like COVID isn't going to be available.
These nurses tell me their hospitals are overflowing with sick patients. They're being allowed 1 gown a day and sometimes 1 mask a week.
We leave our families behind. We want to be respected for the work we do, and we don't want to be taken lightly. We put our lives on the line every day.
Really, the most valuable asset that this hospital has is the workers. The N95s are going to be useless if all of us continue to get sick and can't work.
You know, we can make 1 million Super Bowl t-shirts in one night when somebody wins the Super Bowl, and we can't make masks. I'm tired of these excuses.
Our doctors are getting sick, our nurses are getting sick, so many other healthcare workers are getting sick, and you look at what we are wearing in comparison to other countries, and it's unacceptable.
You don't send a fireman into a fire without his fire gear. Well, don't send us into this fire without the right gear.
Asking for support from our leaders to make sure that when we walk into these environments, we are protected with the proper gear that we need, and that we are able to also provide proper care and proper equipment for our patients.
Every healthcare worker infection, every healthcare worker death is preventable.